Good morning. I'm Kitty O'Hare, a Med-Peds primary care doc with both Boston Children's and Brigham and Women's hospitals. In the original Broadway musical of Peter Pan, there's a song that goes, "I won't grow up." I think every kid everywhere has said that phrase at one time or another. I know that I did. Growing up is hard. There's a lot you need to learn to negotiate. Everything from finding a job, to finding a place to live, to being in a relationship. Now add in the extra complexity of living with a chronic medical condition. Meet Danielle, a young woman who started coming to see me in her early 20s. Danielle was born with several holes in her heart and needed a number of surgeries when she was a baby. These surgeries fixed her heart, but left her with other health problems, including failing kidneys, chronic pain, and learning disabilities. But despite all this, Danielle has the same hopes and dreams that we all do. She goes to work every day, and she wants to spend time with her boyfriend. Danielle is now standing on the physical bridge between Boston Children's Hospital and Brigham and Women's Hospital. And she came to see me because her pediatrics team said, "You're getting to be a little bit old for our children's hospital." There are millions of young people like Danielle in the United States, living with all kinds of chronic conditions, ranging from diabetes and heart disease to autism or Down syndrome. We have done a fantastic job helping people with chronic conditions grow up. So much so that over 90% of kids with chronic conditions will live to be adults. For example, for people like Danielle who have a heart disease they were born with, there are now more adults living with a congenital heart disease than there are kids. Another good example is the lung disease cystic fibrosis. Back in World War II, if you were born with CF, you died by your first birthday. Now, people with cystic fibrosis live into their 40s and 50s and have families of their own. So in the respect that we're helping people live longer, we're doing a great job. But fewer than half of these young people with chronic conditions report getting any help at all with the growing up process, with their transition to adulthood. And this is a really big deal. The transition to adulthood is actually a dangerous time in a person's life. We've found, for example, that young people with sickle cell disease, a blood disorder, are more likely to die during their handoff to adult care than they are as younger children or as slightly older adults. Our young people want help with growing up from their health team. When asked in national surveys, they would like their health team to give them some advice about educational opportunities and how their health condition will affect their going to school. They want to know how their health insurance will change as they grow up. They want to know how their own physical health needs may change. And they would like some assistance moving on to adult care. When you put all this together, though, youth say we're only helping them about 25% of the time with all these things. Just like Peter Pan had to fight the crocodiles and the pirates, there are a lot of barriers for our young people on their road to adult life. Pediatricians feel very strongly about their patients and often don't want to let them go. Also, pediatricians often don't know much about what goes on in the adult medical system, let alone the rest of the adult world. Patients and families hold on to their pediatric team. They may have known their pediatric team since birth. They may credit their pediatric team with saving their life. Why would they want to go anywhere else? And the adult side of the health system often knows nothing at all about the health conditions that are now surviving to adulthood. Many internists and family docs never learned anything about congenital heart disease or sickle cell disease when they were in school. So we have a lot of barriers to overcome. So over the past year, we've been exploring some pixie dust ideas to try to make a difference in transition care. The first idea is that transition should be a team sport. Too often when I talk with primary doctors or patients about what makes transition so difficult, they say it's because they're doing it on their own. Well, what if we all worked together? And that's just what we're trying to do at Boston Children's Primary Care at Longwood and at Martha Elliott. On our team, we have patient navigators who assist our patients in calling up that adult primary care doctor's office, making the first appointment, and transferring their records. We have nurses who coach our patients to take better care of their health, like how to take that confusing asthma medicine. Our social workers perform mental health assessments and make needed referrals into the adult mental health system. Our doctors and nurse practitioners, together with our families, are managing the whole process and doing the broad overview of the transition period. Already, our team is telling us that they feel a lot more confident moving on in transition. And our family advisory board is just thrilled that our health team is now acknowledging that people do grow up. But the team needs a little bit of help to do a successful transition, which leads us to the second idea, collecting resources. Now, I am a transition specialist. I'm familiar with a lot of agencies in the greater Boston area that help youth in transition. And all of my knowledge is in my head or on the Excel spreadsheet on my desktop, which isn't very useful to anyone else. So we said, why not make some community connections? Why not find a way to make it easy to reach out to the community agencies that provide help with education, that provide help with assisted living or job training. So my students and I partnered with an existing group at Boston Children's Hospital, as well as the Boston Public Health Commission, to develop a website called Help Steps. Help Steps is web-based and is curated, kept up to date annually. It's a place where we can list all of those agencies that provide assistance with healthcare, education, adaptive transportation and adaptive housing, perhaps food insecurity or adaptive recreation, all of the needs that young adults in transition have. We have tried this out in certain clinical areas around the hospital, not just in primary care, but also on the floors. And patients and team members are very excited that they now have an up-to-date resource for finding what they need. And the Help Steps team has found that patients who use this website, as opposed to just Googling something, are much more likely to connect with the resource that they need and end up using it. In the future, we hope to keep partnering with community agencies and with state Title V agencies to make this website used in more settings outside of our hospital. So back to Danielle. I'm happy to report she's doing pretty well. We moved all of her health care over to Brigham and Women's. She now sees all of her adult specialists at the Brigham. She sees me in my adult primary care office at the Brigham. She's going to work. She's spending time with her boyfriend. With a little bit of transition support, we can help all of our young adults fly. Thank you.